Welcome back. Joining us now is Africa 54 health correspondent Linord Moudou with a look at malaria and meningitis. Hello, Linord.
Hello, Vincent. Hello, everyone. Niger's Prime Minister has ordered all schools around the capital, Niamey, closed until Monday and called for children between ages 2 and 15 to be vaccinated against meningitis, a potentially fatal disease. More than 900 cases of the disease have been diagnosed since January, resulting in 85 deaths. Prime Minister Brigi Rafini says the country needs more than 1 million doses of meningitis vaccines, but has only about half that many. He has made an international appeal to help make up the shortage. The meningitis virus attacks the lining surrounding the brain and spinal cord and could lead to deafness and severe brain damage. Malaria has been a leading cause of illness and death throughout history. As many as 3.3 billion people around the world live in areas at risk of malaria in 107 countries or territories. Although preventable and treatable, the World Health Organization estimates there are 198 million cases of malaria worldwide annually, killing 584,000 people yearly. Moreover, the most vulnerable and poorest in society face the most burden of the disease, with approximately 85% of malaria deaths are under the age of 5, and 90% of those deaths are in Africa. Now, joining us via Skype from Jeddah, Saudi Arabia, for more on the subject is Dr. Fatoumata Nafo-Traore, Executive Director of the World Malaria Partnership, RBM. Dr. Traore, welcome to the program.
Thank you very much.
Now, Dr. Traore, the World Malaria Day is approaching on Saturday, April 25th. What is RBM's focus?
Our focus for the last 3 years have been really around a theme which is investing in malaria to defeat it. For the last 3 years, our plan was to accelerate the fight and to ensure that we're getting close to the Millennium Development Goals. So it has been a race since 2012, and we hope that today we can say tremendous progress has been done and that more lives have been saved.
Now, when we look at, when we hear about preventing malaria, there seems to be a big push with regards to the use of bed net, insecticide-treated bed nets, which in some cases works, according to some reports. Malaria is caused by mosquitoes. The United States was successful in eradicating malaria in the late 40s, early 50s, with an aggressive approach in environment. There was the spraying of DDTs inside homes. There are also drainage, removal of mosquito breeding sites, and so on and so forth. What about this approach in terms of Africa? Have we attempted to go aggressively in cleaning the environment and killing the mosquito before they can even reach the bed nets, for example?
Oh, thank you very much. For the last 10 years, 1 billion nets have been distributed, mainly in the African region, but yet, if you look at the coverage and bed net, it's still 50%, meaning that really half of those who need to get under bed net or to get in a protected houses are not yet really covered. In fact, if you look at the fight against malaria, it is a combination of different tools that would really make the fight successful. There is not that really focus on bed net alone. Indoor residual spraying is being done. Environmental management is being done. Bed net is really an additional tool. Probably this is where really a lot has been done to expand the coverage, to reduce contact between human being and the vector. But we are really talking about an integrated vector management, because bed net might be the best tool in some areas, in others it won't be. Yeah, you're right to say that in the Americas, the fight has been done by cleaning the environment. It is true that development alone will really reduce malaria and its impact. But today, really, one has to the 4 million lives that have been saved, which is really a great success.
Unfortunately, we have to leave it there. Dr. Nafo-Traore, thank you so much for joining us from Jeddah.
Thank you very much. Thank you for giving me the floor. Thank you.
And that was Dr. Fatoumata Nafo-Traore. She is Executive Director of the World Malaria Partnership. The WHO estimates that 3.4 billion people are at risk of malaria, with children under the age of 5 and pregnant women being the most vulnerable. As World Malaria Day approaches on Saturday, mortality rates are falling, and a new test, well into the last stage of trials, is having positive results in Kenya. We get more from Lenny Ruvaga in Nairobi.
Fatoumata Nafo-Traore, a mother of 2, lives in the coastal region of Likoni in Mombasa. 2 years ago, most of Chaunga's income from selling French fries and deep-fried buns was spent on hospital bills to treat malaria. Mombasa is a malaria-prone region. More than 60% of the population is at risk of malaria in Kenya, where almost 36,000 children die from the disease each year. A non-governmental organization called Population Services Kenya distributes insecticide-treated bed nets to pregnant mothers and mothers with children under 1 year old. Chaunga was one of the beneficiaries.
If I do not use the net, my children will get malaria, and I will have to go to the hospital or use herbal medicine. That is before I knew the MRDT. Now that I know of it, I see the importance of using the net so as to save on costs on going for treatment and use the little money I have to sustain my family.
The MRDT Chaunga mentions is the Malaria Rapid Diagnostic Test. In 2010, the World Health Organization recommended every suspected malaria case be confirmed by parasitological testing. PS Kenya provides the test to more than 4,000 public health facilities. The MRDT gives results in 20 minutes and costs $1, which is affordable even in rural communities. Dr. Dismas Osoro says it has helped reduce the abuse of antibiotics.
Because earlier people were just taking antimalarials without a test. So this time we have got the importance of it. We test and we dispense antimalarial. So the reckless use of antimalarial drugs has been in control.
The World Health Organization estimates there were 198 million cases of malaria in 2013, which led to 584,000 deaths worldwide, most of them in Africa, among children under the age of 5. That makes mosquito net distribution in malaria endemic regions crucial. But according to PS Kenya Regional Programs Coordinator James Makiri, the biggest challenge is changing mindsets.
People tend to sleep under nets during the rainy season, but during the dry season where it's hot, they don't sleep under net because it's too hot. So what we are trying to do is encourage people to sleep under net every time of the year.
For 30 years, the U.S. Centers for Disease Control and Prevention has collaborated with the Kenya Medical Research Institute to fight malaria. This collaboration is developing a vaccine being tested on 16,000 children. Professor Francis Kimani says the results have been promising, but it's only part of a multi-pronged effort.
We are coming up with newer vector control methods. We are coming up with newer drugs. We are monitoring the drugs that are in use to make sure that they work well and users use them well. And also we are coming up with new strategies to protect the host. And when you do all those things in an integrated fashion, we are hoping that at the end of the day, we'll win against malaria.
Fatoumata Nafo-Traore says she hopes that more and more people will embrace mosquito nets and embrace modern methods of testing for malaria, further bringing down mortality rates that WHO says are at 47% globally and 54% in Africa. Lenny Ruvaga for VOA News, Nairobi, Kenya.
And that's our Africa Health Report for today. Back to you, Vincent.
Well, Linord, thank you very much, and I'll be sure to look out for Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.